Hey everyone! Today we're diving into a topic that's both fascinating and deeply concerning. The price debate surrounding Gilead's miracle HIV drug, Lenacapavir. This drug has the potential to revolutionize HIV prevention, but its accessibility is a major issue, especially in Latin American countries. So let's break down why this matters and what it means for the future of HIV treatment and prevention. First things first, Lenacapavir is a game changer. It's an HIV pre-exposure prophylaxis, PrEP medication that's almost 100% effective in preventing HIV infection. Just 2 shots a year can provide protection, even for those frequently exposed to the virus. This is a huge deal because for the first time in the 4-decade fight against HIV, we might have a tool that can all but eliminate the risk of infection. But here's the catch. It's incredibly expensive. In the United States, a dose of Lenacapavir costs a staggering $14,000. That's a huge barrier for most people, especially in Latin American countries where the drug was tested. Gilead, the company behind Lenacapavir, has agreed to license generic versions at around $40 a dose in 120 low- and middle-income countries. However, many Latin American countries like Brazil, Mexico, Argentina, and Peru are being quoted a much higher price which they can't afford. These countries have serious HIV epidemics and have even contributed to the clinical trials that prove the drug's effectiveness. But their status as upper-middle-income countries means they don't qualify for the reduced price. It's a catch-22 situation. They're too rich to get the cut-price version but too poor to pay the U.S. price. This has sparked anger and protests at the International AIDS Society conference in Rio de Janeiro. Activists are demanding access to the drug, chanting, "Pharma greed is killing us, and pills cost lives." It's a powerful movement, and it's not just about the price. It's about the ethical implications of innovation without access. Dr. Alexander Padilha, Brazil's health minister, put it best: innovation without access is not an innovation, it is an injustice. Gilead is negotiating with regional Latin American governments, but the price they're asking for is a sticking point. Some suspect Gilead is holding out because Brazil has a law that obliges the state to provide treatment, no matter the cost. This might be working against them in negotiations. The situation is complex. Gilead says they're working collaboratively with governments and communities, but the lack of a deal is frustrating. The company has a reputation to uphold, and the slow rollout of Lenacapavir is a concern. Despite being a major player in HIV innovation, Gilead's actions are being scrutinized. However, there's a glimmer of hope. Latin America's largest biomedical research institution, Fiocruz, is exploring manufacturing alimatravir, another long-acting PrEP drug. If successful, this could provide Brazil with an alternative route around the pricing standoff with Gilead. Additionally, Brazil is incorporating 7V Healthcare's long-acting cabotegravir into its PrEP program, which is a positive step forward. The issue of accessibility is a major constraint. The drug was only first licensed in its twice-yearly form in 2025, and manufacturing capacity is still building. Even in countries covered by Gilead's discounted license, doses are scarce. The goal is to scale up access to 20 million people within 3 years, a target that's achievable, according to UNAIDS. In conclusion, the price debate over Lenacapavir is a complex issue with ethical, economic, and political implications. It highlights the challenges of making life-saving innovations accessible to those who need them most. As viewers, we should be aware of these issues and support efforts to ensure that HIV prevention and treatment are available to everyone, regardless of their income level. What do you think? How can we address this issue and ensure that the benefits of medical innovation are shared equitably?